Hello, I am Dr. Mukesh, consultant psychiatrist. Today I am going to talk about alcohol dependence or how to identify that a person has become dependent on alcohol. There are few criterias, around 6 points, out of which if 3 are present over a period of 1 year, then we clinically label a person as dependent on alcohol. First of all, there is a strong or compulsive desire to take alcohol. Difficulty in controlling substance taking behavior in terms of its onset, termination, or level of its use. A physiological withdrawal state. So withdrawal is when you are taking alcohol for a long time and there is sudden interruption. There will be some physical symptoms. I will talk about it in details later on. Evidence of tolerance. So if a person is getting a desired effect of alcohol at a lower dose, after some times or after few months he may be needing a higher dose of alcohol to get the same pleasurable effect or the same desired effect. So there is gradually an increase in the quantity of alcohol being consumed. Progressive neglect of alternate source of pleasure, be it your work, be it your family, be it your finances. So alcohol crowds out everything. So highest priority is being given now to the alcohol. Persisting with the alcohol use despite knowing the harmful consequences. For example, if a person has been diagnosed with alcohol related issues and problems which are now on paper and has been formally communicated to him, and patient even then continues with alcohol despite knowing the consequences of it. How to help a person with alcohol dependence? What can be done? First and foremost, the family has to understand one thing, that alcohol dependence is just like any other illness. There are biological, psychological, and social factors involved in it, just like any other psychiatric illness. So, first of all, rather than attributing it to the personality of a person, it should be understood that this pattern of behavior is a problem and it needs to be treated. How can we start the treatment of a person who is not willing to accept that alcohol is a problem in itself? So, enhancing the motivation of a patient, bringing about or talking about all the possible deleterious effect which may be affecting him, be it physical consequences like alcohol related liver disease, anxiety or depressive illnesses attributed to alcohol. Social issues. A person when affected with alcohol doesn't have much say in the social situations. Family also starts neglecting him when it comes to major decision making in the family. So these points can be brought in front of the patient. Then there are the financial aspects of it. Preferring alcohol over alternate source of pleasure, which I have talked about earlier. So person starts consuming alcohol in the morning, in the daytime, and it affects the employment and financial capabilities of the person. So bringing all these problems, all these possible problems on the plate, and increasing the awareness of the patient in this situation may bring some degree of insight in the patient that okay, this may be a problem. And when this situation arises, a level of motivation comes in. A level of motivation comes in where patient thinks that he will be or she will be looking to address it. Earlier, I talked about withdrawal symptoms. Clinically, the patient presents with the withdrawal symptoms such as tremors of hand, disturbed sleep, irritability, nauseating feeling, at times confusion or inability to identify the people around you, loss of touch with reality, at times hearing voices or noise which makes the patient feel scary. These symptoms are the withdrawal symptoms, and they are most often alleviated by consuming alcohol. So initially the patient consumes alcohol for the sake of pleasurable effect, but later on to avoid the symptoms associated with withdrawal. I would like to also point out that alcohol has deleterious effect on different organ systems including liver, central nervous system, GI tract, leading to multiple complications. At times patient present with the vomiting of blood, black tarry stool, gastritis, cirrhosis of the liver, leading to the multiple complications like ascites, piles, etc. There are good medications available to control the withdrawal symptoms. So initial treatment phase, we say it as detoxification, where the withdrawal symptoms are controlled. And second phase is to control the craving. So anti-craving medications are given. Along with this, motivational enhancement therapy, regular interaction with the patients. So if the patient remains abstinent for 3 months or more, the chances of remaining abstinent increases. I hope I have answered some of the questions associated with alcohol dependence in this video. Thank you.